go back to the first slide.
Okay, so you want me to go through again?
Yeah, we'll just start. Sorry about that, but I think...
That's okay. Why don't you go to the next slide, and I'll just review quickly the learning objectives here for today's webinar.
Yep,
so
let us know when we need to change slides.
Sure.
Okay.
So we hope that after today's webinar, you'll be clear on what integrative oncology is and why it's important, be able to describe reasons for integrating complementary therapies into cancer care, appreciate through a comparative case study that we'll be sharing with you the differences between a conventional and integrative approach to navigation, describe the role of integrative navigation across the cancer continuum, and recognize the growing support for integrative navigation in professional training. Next slide, please. So a little bit about Smith Center and our institute. Smith Center was established in 1996, and we're the Washington, D.C.'s only standalone organization that offers psychosocial and creative resources to adults with cancer. Our programs include week-long residential retreats, weekend retreats, and classes and workshops in health supportive therapies such as yoga, stress reduction techniques, and nourishment for people living with cancer. We also have a healing arts gallery and offer many programs and community events on the nature of healing. Since 2007, we've provided individual services and programs in patient navigation that are based on our integrative model of navigation that we'll be sharing with you in a few minutes. Late last year, we formally launched our Institute for Integrative Oncology Navigation, or ION. If you could go back, please. You're going ahead too quickly. Okay. Just stay there for a moment, okay? Our goals at ION are focused on educating navigators and providing quality integrative patient navigation, establishing our model as a standard of care offered by oncology navigators nationwide, and raising general awareness of and appreciation for integrative navigation among healthcare professionals, patients, and the general public. Next slide, please. To meet our goals, we offer trainings, workshops, and seminars on various aspects of integrative navigation and integrative oncology, participate in national dialogues on the future of oncology care, develop and advocate for national oncology navigation policy, and provide individual integrative navigation services. And today we hope to raise your awareness of and appreciation for what integrative oncology and integrative navigation is. So my colleague, Laura Pohl, will begin by walking us through the landscape of integrative oncology.
Okay, good morning, everybody. Oh, and here we are on the right slide. Again, it's green, and we developed these slides long before we knew this would be on March 17th. So thank you so much to the Maryland PNN for hosting this program and inviting us to present. I'd like to give you a brief introduction to what integrative oncology is so that you can understand the framework that undergirds integrative oncology navigation. Next slide, please. Great. Integrative oncology is an evidence-based specialty that thoughtfully coordinates and blends medical treatments with complementary therapies, sometimes known as complementary and alternative medicine, or CAM. The goal is not more is better. Rather, the concerted effort is to enhance the efficacy of medical treatments and relieve the patient's distress and suffering. The word integrate means to form, coordinate, or blend into a functioning or unified whole. So it's important to be clear that the piecemeal use of complementary therapies with conventional therapies is not integrative oncology care. Next slide. Through a strong relationship, patients and their doctors and other care providers share in decision-making. All the stakeholders understand and trust in the individual's innate healing capacity. Quality of life is a key value guiding care. Next slide. There are a number of factors bringing integrative oncology to the forefront. We're all aware of the steadily rising incidence of cancer and the cost of cancer treatments. Estimates from the American Cancer Society, the American Institute for Cancer Research, and the Cancer Research UK are that 30 to 90% of all cancers can be prevented by people changing their lifestyles and their environments. We're also now seeing encouraging research that lifestyle and nutritional interventions can prevent cancer recurrence. More and more people can expect to be long-term cancer survivors. They're hoping for quality of life in their survivorship years. While those with cancer reportedly are the largest patient population using CAM, they often don't tell their doctors about their CAM use. Until we become more integrative in our approach to cancer care, patients will continue to be closeted users of complementary and alternative medicine. Next slide. Now, let's define what we mean by CAM. On this slide, you see the definition of CAM used by NIH's National Center for Complementary and Integrative Health, also known or called NCCIH. By the way, up until last December, NCCIH was known for many years as NCCAM, the National Center for Complementary and Alternative Medicine. According to NCCIH, many Americans, nearly 40%, use healthcare approaches developed outside of mainstream Western or conventional medicine for specific conditions or overall well-being. Next slide. So that you understand what is meant by conventional medicine, this term refers to medicine that's practiced by MDs, DOs, and allied health professionals such as nurses, PTs, OTs, and psychologists. Sometimes conventional medicine is also referred to as Western or mainstream medicine. Next slide. According to NCCIH, when describing health approaches with non-mainstream roots, people often use the words alternative and complementary interchangeably, but the two terms refer to different concepts. Complementary generally refers to using a non-mainstream approach together with conventional medicine. Alternative means using a non-mainstream approach in place of conventional medicine. True alternative medicine is not common. Most people use non-mainstream approaches along with conventional treatments, and the boundaries between complementary and conventional medicine overlap and change with time. For example, guided imagery and massage, both once considered complementary or alternative, are now used regularly in some hospitals to help with pain management. Next slide. Now, NCCIH prefers to use the term complementary health approaches when discussing the practices and products they study for various health conditions. They've recently revised the way they classify the various complementary approaches, dividing them into the categories of natural products, mind and body practices, and other complementary health approaches. Next slide. Doctors June Mao and Lorenza Cohen, two leaders in integrative oncology, authored a monograph in the Journal of the National Cancer Institute. They offered several benefits of including CAM in cancer care. CAM may help to improve response to standard medical treatment, manage side effects of cancer treatment, prevent or manage cancer symptoms, improve survival, and enhance a sense of well-being and quality of life. Next slide. The good news is that we're seeing a body of research emerge to support integrating CAM with conventional cancer treatment. The Society for Integrative Oncology, SIO for short, and the NCI's Office of Cancer Complementary and Alternative Medicine are two organizations ensuring the quality of research related to CAM and integrative cancer care. This slide from the NCCIH website summarizes the status of evidence for CAM in cancer. According to the NIH, there's a substantial scientific evidence that some complementary health approaches may actually help manage or abate cancer symptoms and treatment side effects. At this time, there's no known complementary health approach which, by itself, can effect a cancer cure or remission. Though no CAM approach has been proven to prevent cancer, there is a growing body of population research to support making certain lifestyle changes to prevent cancer. Next slide. Dr. Jeffrey White, Director of NCI's Office of Cancer Complementary and Alternative Medicine, recently authored a chapter in Abeloff's Clinical Oncology textbook. He summarized the interventions that have been studied as a means to improve quality of life, prevent or manage cancer symptoms or adverse effects of treatment, as well as improve survival or the response to standard medical treatments. The following 5 slides list some of the research highlighted in Dr. White's chapter. I won't go over each slide individually, but I want you to have them as references. So if you all would just go through the next several slides, and just hold there for a moment. And next slide. And the next slide. So here you see symptom and adverse effect management and quality of life related research. Next slide. Here's some symptom and adverse effect management and research on quality of life again. Next slide. And more of the same. And next slide. Okay, thank you. In a preface of the SIO's Integrative Oncology Practice Guidelines published in 2007, the authors give rationale for cautious optimism as well as forging ahead with developing an evidence base for using complementary therapies in integrative cancer care. They also emphasize that a balanced approach and open mind is needed as we evaluate not only the scientific research, but also the individual's needs, their responses, and their experience. Next slide. Thank you. In addition to its general practice guidelines for integrative oncology, the SIO has published clinical practice guidelines on using integrative therapies in patients treated for breast cancer and lung cancer, as well as guidelines in integrating dietary supplements and botanicals into cancer care. These guidelines are milestones in informing oncology care providers on the evidence base for using certain complementary health approaches in the clinical setting. We provided the citations for these guidelines in the following 4 slides. So if you could scroll through the next 4 slides so that people see, and you will have access to these slides, so you will be able to get the references and access these articles, which are very rich. Okay, one more? Thank you. The Oncology Nursing Society, the nationally recognized professional organization for oncology nurses, created a position paper on using complementary, alternative, and integrative therapies in cancer care. Next slide. One of the major takeaways from this presentation is understanding what oncology nurses and other disciplines of navigators should bear in mind. Key points from the ONS position paper provide a basis for this understanding. We must examine our beliefs about integrative care and ask how they might affect your patient's care. No matter how much or how little you know about integrative care, it's important to assess your patient's interest in an integrative approach and at least provide credible information and guidance. Learn the lingo. Educate yourself to the extent necessary for your scope of practice. Know about the potential side effects and interactions of integrative therapies. Record and communicate what integrative therapies your patients are using and their responses to them. If you are going to directly provide any integrative therapies, get training and credentials. Help your patients navigate the maze of cost reimbursement and other complex issues. And finally, if you're working to set up a practice or program that provides integrative cancer care, be sure that it's based on the evidence. Next slide. The following 3 slides list for you some selected reputable websites for information on complementary and integrative oncology, and you will have access to these when you go to the website later and get these slides. So can you scroll through the next couple more slides? Great. And thank you. Stop there. Compliments of Dr. Matt Mumber, who is an integrative oncology radiation specialist at the Harbin Clinic in Georgia, and he's also on the board of directors for the Society of Integrative Oncology. And thanks to him, I'd like to tell you about the conventional interventions used for treating a 46-year-old mother of 2 grade school-age boys. This patient, who is an amalgamation of 2 different but actual patients, had stage 4 triple-negative breast cancer with a single bone met. She had the usual workup. She was offered the best in conventional treatment: IV chemo, mastectomy, radiation to her bone met, and ongoing IV Zometa. She took high-dose antioxidants and herbs during chemo and radiation therapy, and not surprisingly, didn't tell her doctors about this. She missed lots of appointments because social and family concerns got in the way. She didn't complete all her treatment. She stuck with her standard American diet, also known as the SAD diet. She became fatigued and slept more often. She developed lymphedema in her arm. She didn't come back for follow-up, but went instead to a faith healer who prescribed homemade herbal supplements. Stay tuned for a rewrite of this story after we tell you about integrative oncology navigation. And now I'm going to switch over to Carol, and if you all could, yes, next slide.
Great. Thank you, Laura. So after hearing Laura's review of the use of CAN in cancer care, how do we offer integrative oncology through navigation services? In other words, what is integrative navigation? Next slide, please. Patient navigation in oncology care was born from the frustration and foresight of Dr. Harold Freeman, working with the medically underserved in Harlem, who were consistently presenting with advanced cancers or falling through the cracks when receiving care. He conceived the idea of a trained individual acting as a guide to patients in accessing care and ensuring that they receive timely diagnostic services and treatment. Next slide. His development of patient navigation in the early 90s led to research proving its value in improving breast cancer screening rates in 1995 and improving 5-year survival rates by 31% 10 years ago. And over the years, there have been national research programs on patient navigation, as well as multiple studies demonstrating the value of navigation in offering support, assistance with information needs, problem solving, and coordination of care. Dr. Freeman's work in the development of navigation has been invaluable to patients in removing some of the barriers to cancer care, such as financial barriers for the uninsured and underinsured, communication barriers, medical system barriers, and transportation or child care barriers, all of which can negatively impact a patient's ability to seek and obtain medical care or complete treatment. Clearly, navigation has had a positive impact in moving patients successfully through our medical system. However, delivery of cancer care remains highly fragmented, as acknowledged by such esteemed organizations as the Institute of Medicine and experienced by almost every cancer patient. The late Jesse Grumman, who lived with several cancers and was president and founder for the Center for Advancing Health, sums it up eloquently. Each of the 4 times I received a cancer diagnosis, I felt like I had been drop-kicked into a foreign country. I didn't know the language, I didn't understand the culture, I didn't have a map, and I desperately wanted to find my way home. The experience of cancer and navigating our complex medical system all too often takes a severe toll on the individual's physical energy, emotions, and spirit. Too often we hear from patients how dehumanizing the cancer experience can be. The integrative oncology movement is fueled in large part by patient demand for patient-centered, whole-person care. In the recent NCI monograph on integrative oncology that Laura mentioned earlier, Drs. Mao and Cohen stated, "More than ever before, cancer survivors desire the evidence-based integration of complementary and integrative medicine into conventional cancer care, not only to treat their cancer, but also to help in the healing of mind, body, and spirit. Next slide, please. Integrative navigation can contribute to reducing fragmented care by assisting patients in their healing on all levels, not only the physical, but emotional and spiritual healing as well. Next slide. So please take a moment now to read our definition of integrative navigation. We strongly believe that every cancer patient deserves access to what we call the best of both worlds, what is available from both conventional medical treatment and from appropriate, evidence-based, complementary supportive resources. We view integrative navigators as critical players in the healing of individuals by supporting them to engage more deeply in their care. Integrative navigators are trained to educate patients on appropriate, proven resources in complementary cancer care, such as nourishment, stress reduction techniques, body or energy work, such as acupuncture and massage, all of which can contribute to whole person healing. They are also skilled in educating and supporting patients so that they can make responsible selection and use of these therapies, such as how to identify reputable information sources or interview potential integrative practitioners. Of course, this is all under the approval of their treating oncologist and in coordination with the patient's medical team. Integrative navigators serve as part of the medical team with special training in how complementary therapies can support a patient. Next slide, please. This graphic represents our model of integrative navigation, illustrating the solid foundation of knowledge, skills, tools, complementary therapies, and support that can be provided by navigators to help move a patient from a place of fear and a sense of helplessness and hopelessness to a place of strength and engagement that improves the quality of the cancer experience overall. Our model uses a patient-honored approach where we help adapt the system as much as possible to the individual's needs so that they can be better met and healing is supported along the entire cancer continuum. Next slide. Since 2007, we've applied this model in serving our city's underserved African American and African immigrant residents in both hospital and community settings. This was done through continuous grant funding that included rigorous independent evaluations from Howard University's Center for Urban Progress. Next slide, please. Our hospital integrative navigation program was instituted at Howard University Cancer Center, where our population was presenting with advanced cancers at 5 times the national average. In our first year of operation, the hospital, in its internal quality improvement review, noted that we contributed to a 15% improvement in treatment compliance rates. We ran the program for 5 years with continuous grant support until the hospital took over fiscal and operational management of the program as a permanent hospital service. Next slide, please. An independent evaluation by the Center for Urban Progress of 37 patients reported that 73% of those surveyed had used the navigation services. Using a Likert scale, 86% rated the navigator as very effective in supporting them through diagnosis and treatment. The program was highly regarded by clinical staff. The CUP study also found that the overall hospital climate can impact the use of integrative resources and that patients were more likely to use complementary therapies post-treatment. The independent evaluation was reported in a larger article on addressing psychosocial barriers in African Americans with breast cancer through integrative navigation that was published in the Journal of the National Black Nurses Association. Next slide, please. We then extended our model out into the community, partnering with several African American churches and employing cancer survivors as community navigators, some of whom are pictured here. Next slide. Our community navigation program reached over 12,000 underserved residents, offering outreach, raising awareness of navigation, providing individual support, educational workshops and classes, and serving as liaisons to hospital-based navigators and facilitators to clinical and supportive services. Next slide, please. The CUP independent evaluation of the community integrative navigation program included extensive surveys of our navigators and their patients community partners, and evaluations of educational events and programs. Next slide. Our navigators reported strong support for their work from the community at large, as well as their individual patients, and church leaders considered navigation services as important as any of their existing programs. Patients praised the assistance they received from their navigators, and the educational programs demonstrated positive changes in health behaviors and had a positive impact on raising awareness of wellness and navigation. For instance, one of the most successful programs our navigators offered was a 6-week educational series called Healthy You that provided instruction and experiential activities in the areas of nutrition, stress reduction, and exercise, all of which have been shown to be useful in supporting people through cancer and into recovery. A 4-month follow-up survey of program participants of Healthy You reported a 25% improvement in daily eating habits, a 46% increase in stress management practices, and regular fitness practice doubled. Next slide, please.
Carol, while we're waiting for the slide change, someone is typing probably on their keyboard, and I wonder if they might mute their phones. Thank you.
Thanks. Okay. The next 2 slides summarize what integrative navigators provide. You may notice that there's close alignment with some of the services offered by traditional navigators, but you will also notice that we are enhancing and expanding the role patient navigators play by educating patients on the role and value of supportive complementary therapies. Integrative navigators often may take the lead in facilitating access to complementary resources, perhaps introducing CAM therapies to patients, such as offering general nutritional guidance and information, demonstrating breathing practices, or offering patients simple stress reduction techniques. Integrative navigators guide patients to reliable sources of information on complementary therapies. But we want to stress again that we consider the navigator to be part of the patient's medical team, and that any information on complementary cancer therapies offered to the patient by the integrative navigator is done in concert with the patient's oncologist. Next slide, please. Through emphasis on deep culturally sensitive listening and communication skills, integrative navigators are trained to work in partnership with each patient to identify what the individual feels stands in the way of their healing, and to equip each patient with the tools, skills, and knowledge from the complementary arena to facilitate healing and a better quality of life at every stage of the cancer experience. To illustrate this, let's look at what is often a difficult topic for healthcare professionals to address: the spiritual needs of cancer patients. Integrative navigators are trained to screen for spiritual distress, initiate a conversation with their patients, and depending on their interaction with their patients, suggest resources and offer to connect them to more specialized spiritual care professionals. Their boundaries are clear. Integrative navigators do not provide professional spiritual counseling, but in an often neglected area of patient care, they can step in to support their patients by acknowledging their spiritual needs and connect them to resources that can help them in this area. Next slide, please. Next slide, thank you. The distinction between patient navigators and integrative navigators is illustrated further by the following chart that walks us through the primary roles integrative navigators can play at each stage of the cancer continuum. It highlights some of the most common needs of the patient at each stage, the primary assistance that integrative navigators can offer to the patient at that time, and also what complementary therapies may be most helpful to the patient to address those needs. Next slide, please. For instance, during treatment, patients are most likely to be consumed with mentally and physically preparing for procedures, juggling treatments with their personal lives, dealing with side effects from both their treatments and perhaps their cancer, and staying focused on completing treatments while keeping their anxieties at bay. So what are the primary roles of the integrative navigator during this phase? In addition to helping patients stay organized and on track with their medical treatment plan, integrative navigators serve as coaches, teachers, researchers, and guides. This is an opportune time for navigators to work with patients and their doctors on developing personal integrative treatment plans that include complementary therapies such as what Laura reviewed earlier. More and more patients are wanting to become more actively involved in their care and need guidance in identifying what is appropriate, safe, and useful in addressing their individual needs. Integrative navigators are trained to guide patients to reputable information sources on complementary modalities, to assist them in finding and assessing CAM resources and professional complementary practitioners, and to communicate with their medical team in developing their integrative care plan under the supervision of their medical oncologist. In practicing whole person care, the integrative navigator is also well equipped to offer a variety of stress reduction techniques and creative resources that support the patient emotionally and spiritually during this time. These may include, for instance, guided imagery and visualization, breath work, progressive muscle relaxation, and other mind-body skills that assist in coping with treatments and reducing anxiety. Patients may also want to explore expressive techniques such as journaling, painting, poetry, and creating meaningful rituals around healing to nourish their spirit. Please notice how closely integrative navigation is aligned with the description of integrative oncology principles that Laura mentioned earlier, such as engaging the individual patient, making use of complementary therapies in concert with their medical treatment, alleviating patient distress, and working to improve the quality of life at every stage along the cancer journey. There are many forces shaping cancer navigation currently at work. Among the most prominent are the ACOS accreditation standards requiring patient navigation services be in place this year. Greater attention is also being given to navigation because of the growing cancer workforce shortage. ASCO has predicted that in 10 years, the demand for oncology services will increase by 42%, while the supply of oncologists will only grow by 28%. Next slide, please.
Okay, I'm about to advance the slides, but I just wanted to chime in with a little time check. We're down to about 5 minutes.
Okay. As the need for navigation is increasingly recognized, so does the need for integrative navigation. Driven by the demand for CAM by cancer patients, the growing support for integrative cancer care among healthcare professionals, including navigators, and research documenting the value of integrative care. So let's take a closer look at each of these 3 points. Next slide. The 13.7 million cancer survivors alive today in the U.S. have become an impressive force and agent of change. And the ASCO report published about a year ago predicts that in the next 15 years, the number of new cancer cases will increase by 45%. Historically, cancer survivors have been shown to be active users of CAM, often segregating their complementary treatments from their medical team. Research estimates vary, but it's generally assumed that about 65% of cancer patients use some form of CAM. Estimates on patient reporting of CAM use to their physicians also varies widely. A review of studies published in a 2012 issue of The Oncologist reported anywhere from 20 to 70% of cancer patients discuss their CAM use with their doctors. So it's all over the map. And as numbers of survivors have increased, so is the change in attitude of survivors, adopting a consumer approach that demands better care, communication with their providers, and more involvement in their decision-making. Survivors are increasingly aware of the relationship between wellness and cancer prevention, treatment, and recovery, and the role CAM can play in that relationship. They track medical and technological advances more closely, and they have greater access to information and resources, including navigation. Next slide. This change in the profile of cancer survivors over the years has naturally had an impact on cancer care professionals. The SIO, which Laura mentioned earlier, just last year invited navigators to their annual conference where they were formally recognized and asked to serve as advisors to the society. Oncology nursing has recognized the consistently increasing use of CAM by survivors and the need for patient guidance and coordination of CAM use with their medical care, as noted in the professional journal Seminars in Oncology Nursing that recently stated the need for all navigators to be well-versed in helping patients to access integrative cancer care therapies. Next slide, please. A recent study of an integrative approach to cancer care in an inpatient setting showed that it can lead to significant cost savings for hospitals. The study was conducted by the Urban Zen Foundation, which is an organization dedicated to changing the current healthcare paradigm to include integrative medicine and promote patient advocacy. The study, conducted at Beth Israel Medical Center in New York City, involved incorporating yoga therapy, holistic nursing techniques, navigation, and a healing environment into routine inpatient oncology care. A baseline sample of 85 inpatient oncology patients admitted to the medical oncology unit before implementation of this integrative approach was compared with 72 patients admitted after the initiative was in place. The study looked at differences in length of stay and medication use between the two groups. While no difference in length of stay was shown, there was a significant decrease in use of antiemetic, anxiolytic, and hypnotic medication costs, as well as a decrease in total medication costs of about $156 per patient per day in the Urban Zen sample compared with their baseline group. The researchers concluded that even with using the most conservative estimate of cost savings, they showed medication cost savings of over $204,000 by the second year of the program, including the startup costs, and that cost savings would continue for the remainder of the life of the program. Next slide. While there's a strong call for continued research in this area, patients and navigators are noting the benefits they've encountered from integrative navigation. Anecdotal information from 59 respondents was collected in a survey of integrative navigators trained by ION from across the country in 2013 and again in 2015. Navigator observations and patient reports credit integrative navigation with improvement in symptoms and concerns after referrals to CAM, a reduction in stress, increased quality of life, and increased sense of control and being treated as a whole person. They reported improved patient satisfaction with feeling that they were listened to as an individual. There was increased knowledge of what they can do to improve their lives with less focus on their limitations and more confidence in their healing, knowing they have other options. They are better able to make informed choices, communicate their fears, and move forward in getting the care they need. There was an increased use of nutrition, exercise, and supportive therapies, along with improved access to complementary modalities that the patients report they would not have sought from their medical team. Improved self-care and involvement in treatment that affects treatment compliance with better outcomes overall, and navigators also report improvement of self-care practices amongst themselves. And finally, patients report having a more positive outlook. They feel better equipped emotionally to travel the cancer journey and feel more hopeful, happier, and able to connect with their loved ones. Next slide. So after hearing about all the value and practice of integrative cancer care, we hope you're wondering about how one becomes trained in integrative navigation. So Laura will briefly walk us through our training program.
Yes, and can everybody hear me? Since we had a little late start due to some technical difficulties, I'm going to say what Einstein always says, never memorize anything you can look up. So I'm really going to breeze through these next few slides. You'll have them as a reference, but we have several slides of what we think are important to include in training of one who wants to become an integrative navigator. And if you would just please advance these slides, I'm not going to discuss them in any detail. We want to leave time for questions. Next slide. So please access the slides through the Maryland PNN, and you can see these. And keep continuing. Next slide. Okay. Good, right there. So I promised you we'd come back to this, our patient here, our 46-year-old mother of two boys who, under strictly conventional medical care and without the help of a navigator, didn't complete her treatment. Remember that during her treatment, she used supplements and herbs without telling her care team. She was even lost to conventional medical follow-up and began using a faith healer. She continued to eat an unhealthy standard American diet. So let's start all over and say she had had an integrative oncology navigator from the get-go and throughout her cancer experience. That navigator screened her for the many distresses that were affecting her life. The navigator connected her to resources to help her pay for her cancer therapy. She made counseling referrals for the patient's distressed sons. The navigator linked the patient into healthy eating classes and taught her mind-body techniques to improve her coping skills. Such therapies, such as massage, acupressure, and ginger, helped her to reduce treatment side effects. The navigator taught the patient that it wasn't a good idea to take antioxidants during chemo and radiation. The patient used physical activity to address her fatigue and had manual decongestive therapy to prevent lymphedema. She made it through all her therapy. In her long-term survivorship, her navigator was there to connect her to a survivorship group as well as pave the way for her to attend a residential retreat. The patient was advised on appropriate supplements to take. She shifted to a plant-based diet. She became a poster child for the benefits of integrative oncology navigation and now volunteers as a peer navigator. Next slide. Next slide, please. Back up one. Thank you. So we want to leave you with a final thought from Dr. Rachel Remen that captures the essence of the value of an integrative approach to caring for those facing cancer. When we are doing healing work, we honor something innate in the person, something which is sometimes deeply buried. The healing work is to bring that out into the light, into the day, and allow it to do its work. Next slide. So thank you, and we will take questions.
Okay, hi, everyone. Thank you so much, Carol and Laura, for presenting for us this morning. I want to apologize first for our technical difficulties earlier. This is our first webinar, so we have a few kinks to work out for the next one. But at this point, we are going to try to unmute your phones, and we have about 5, possibly a few more minutes for questions and answers. If you have a question, oh, actually, we're getting echoed. If you have a question, go ahead and send it using the chat feature. And we'll exit the slide so we can take a look and see what questions we're receiving. Okay, we're looking through chat for a few questions. There is a question about whether the slides will be shared, and we are recording the webinar. So we are going to share them back later this week once we can access the recording. So we'll send that to everyone who is registered, and we'll look into putting that on our website as well for PNN members who weren't able to join. I don't see any more questions, so we'll wait another minute or two just in case. And if you, I'm not sure if anyone's having more technical difficulties, but if you do have a question and you're not able to ask it for some reason, you can always email it to us, or we will include a field on the evaluation that we'll send out for questions that we weren't able to address. And if we receive any, we'll share those back with everyone.
Slides that talk about what's proven and what's safe. You should be able to check that out. And then I guess, but maybe I never would want you to get in trouble for anything.
So I don't think that we have any more questions. So at this point, we'll go ahead and close out the webinar a few minutes early. Thank you, everyone, for joining us this morning. I mentioned evaluation. TWE is going to be mailing that out to everyone this afternoon, so please check it out and send us feedback. Oh, if there's anyone on the call who's not currently a member of the PNN but is interested in joining, please reply to her evaluation email to request a membership form, and we'd be happy to add you.
But you have to be able to do viewing to it.
So thank you so much, everyone. Have a great day.
And thank you so much. Great job, you all. Thank you.
Thank you.